Hi, and welcome back to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
Welcome back. Today we are going to do our second episode in a two-part series on the hot new trend of feeding baby solids called baby-led weaning.
If you haven't listened to our first episode on this, I'd highly recommend it, where we introduce the idea of baby-led weaning, plus spend a little bit more time talking about our own experiences. So that is a really good foundation for what we're going to talk about now.
Great, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Okay, Sylvia, we already laid the foundation in the first episode. We're highly supportive of parents that want to try baby-led weaning. I think that in this episode, we really want to tease apart a little bit of all of the information that is out there on baby-led weaning and what we see as pros and cons.
Right. So the first thing I would like to talk about is their thought of puree feeding as being a force feeding. And I want to just give a little quote from the book just to kind of set the stage for our discussion, Vivian. Okay, quote, "When I was spoon feeding Ivan, I'd have to trick him into laughing to get the spoon into his mouth, but it would just come straight back out. So I'd just get it in from any angle I could before he turned his head away. He obviously didn't want it, but we were convinced he needed the food. So we would sit there, getting frustrated, watching the clock ticking while we tried to get the whole jar into him. Looking back, I can see he probably didn't need it." So I want to first get your thoughts on that quote and that description of what puree feeding was like for this mother, Pam, and her son, Ivan.
Yeah. So I think this is just an example of one parent's experience with puree feeding. I don't think it can be used as representative of what puree feeding is like for most or the majority of infants. I felt so much like that was not my experience as a parent, and that has not been my experience in the office either in talking to patients. I feel like it paints a misleading picture to characterize spoon feeding by that example of a story.
Yeah. And I would also recommend for the listener, if you're really struggling with any type of feeding technique, this would be an appropriate time to bring it up with the pediatrician.
Yeah, for sure.
Right. And I also feel like from a pediatrician perspective on this narrative, if the baby is showing signs of not wanting to eat or being full, like turning their head away, we don't encourage parents to continue to quote unquote force feed their child unless there are medical or extenuating circumstances that merit that.
Exactly.
Right?
Exactly.
And that
exactly.
is to be discussed with your pediatrician.
Yes, totally agree.
Okay.
So that was point number 1.
Right.
Give me another one, Sylvia.
So the other point that I often bring up when parents ask me my thoughts on baby-led weaning is the thought of choking and gagging.
Oh, yes.
So I want to spend a little bit of time first talking about what choking and gagging is and the difference between those two things and how it relates to baby-led weaning.
Well, okay, first off, let's start with gagging because with any method of introducing solids with your infant, at some point your infant is going to gag.
Yeah.
Now, the frequency may vary, but at some point you'll experience that. And that's when they've put a puree or a piece of food in their mouth and they're starting to, they might be coughing, sputtering, they're spitting it out. They're like,
Maybe a little retching.
Yeah, they might even be turning red a little bit. Like there's like that coughing, retching to clear the food from the back of their palate, from the back of their mouth.
Right.
They're clearly moving air in and out because you're hearing it with the coughing and the retching.
Classically, just what we think as gagging. They're gagging on the food, then they're clearing it, and then everything's fine, right?
Yes.
It's a completely self-contained event for the child, right?
Yes, doesn't require any intervention on the part of the parent. The baby is clearly on their own working to clear out that food.
Yes, and we as human beings have all gagged on something before. So we know what gagging is, right?
Yes.
Versus choking. Why don't you describe choking?
Yeah, so choking is when a piece of food gets lodged in the airway at the back of the oral pharynx in the trachea, and the baby, in this case, actually cannot move air in or out. That food is completely blocking their windpipe, that's the trachea, and they are unable to even cough or sputter to get that food out. And you might notice that there's almost like a panic. There's like a trying of breathing or coughing, but that's not
Effective,
working,
right?
not effective.
And choking and gagging can be on a spectrum or a continuum where someone can kind of worry about choking and gagging, and in lay speech they're often kind of used synonymously.
Yeah.
But I think in the medical sense, choking is a very different phenomenon where medical intervention or some sort of assistance, whether or not it's a pat on the back, the Heimlich, or something needs to take place to clear the airway that the person cannot do themselves, right?
Yes.
Yeah. So as parents ask about the introduction of solid foods, often gagging and choking winds up being on some parents' minds, a worry for them, right?
Yeah.
So in the office, this is something, even if we're not talking about baby-led weaning, choking is something that I talk about with the introduction of solids, where there's a particular size of food that we try to avoid in pediatrics. Usually one can imagine it being like the size of a grape or maybe a hot dog cut into cylindrical pieces. That size food should be avoided in introducing solids to your baby, because that diameter is the perfect size to lodge right in the windpipe and block and cause choking. So universally, it's recommended to not introduce that size to the baby.
Which comes to an interesting point, because there are a lot of resources, and I would advise parents who want to do baby-led weaning to look into one of them. Solid Starts is one for an example where it's almost like a dictionary of foods. Like, hey, this is the food that I am making tonight for my family, and it includes apples, for example. And my baby is this many months old. What size of apple am I going to give to my baby? Because it's not necessarily intuitive in that when you're feeding a 6-month-old an apple, of course, you want it to be soft, but you want it to be large, like half of an apple that they can grasp with their full hand and pick up, and then they can kind of suck on and gnaw on. Whereas as they get older, the piece can actually go further down in size where they can actually break off little bits with their mouth and chew. So I feel like those types of resources really delineate what size of food to give at what time is something I would recommend for parents that really are very excited to do baby-led weaning.
Right. And then as a quick cautionary, that particular size that I described, like the grape, the cylinder, is universally avoided. That size is avoided.
Yes. And baby-led weaning resources will say the exact same thing. And I will point out, when you research baby-led weaning, they will point out that there has been a study or two that have demonstrated that if baby-led weaning is done correctly, there's no increase in the risk of choking. But I do feel that for a parent who is correctly doing baby-led weaning, it has been shown that it is as safe with regards to choking.
Right. So let's move on to gagging. Give me your thoughts on gagging and baby-led weaning.
Yeah, so we don't have great data on gagging. I do feel like, as I talk to parents who have done baby-led weaning, or as I hear people describing it on podcasts or other resources, and it's kind of intuitive as well, that when you are early introducing your child to solids versus purees, there's just going to be an increase in gagging, right? I think you need to accept that with any solids, even when we're talking about traditional feeding, as you increase the solidity of the food that you're giving your baby, you need to expect that there will be some gagging. So if you're going straight from the beginning to solid foods, you need to expect that there's going to be some gagging.
Yeah. I feel like the baby-led weaning book highlights some narrative and stories that are very defensive about baby-led weaning and gagging.
Do you have an example?
Okay, sure. So here's a quote from the baby-led weaning book. Many instances of baby gagging are actually related to spoon feeding, especially when lumpy foods are given by spoon. To understand why this is, think about how you use a spoon to eat tomato soup and compare it with the way you eat breakfast cereal. If you were to slurp your cereal the way you do soup, the lumps would go straight to the back of the throat and you would soon start to cough and splutter. When babies are spoon-fed, they tend to suck the food in, so they gag or choke, quote unquote, choke very easily. All right, Vivian, what do you think about that spoon feeding and slurping?
Yeah, no, I've never noticed that, to be honest. I mean, it's very much if you hold the spoon up to the baby's mouth and they start to open, it's like they're using their lips, their gums to pull the food off. I've never experienced that slurping.
Right. I mean, I never see first baby foods being introduced in a spoon to pursed lips.
Yes.
Where they are, like sipping you do a soup.
It's like the wide mouth.
Right. It's the wide mouth where you put it in and the tongue is moving and the bolus is moving to the back of the throat. So I do also agree that in their defense of gagging, they tend to implicate puree spoon feeding as being more prone to gagging in a misrepresentation of what spoon feeding is.
Yeah. I would agree with that. Anytime I hear somebody saying that spoon feeding actually results in more gagging, I would have to disagree with that.
Yes.
We have our 10 kids between us, but also all of our experience in the office. That is not my experience at all. It's the solids. It's as you progress with solids that you have more tendency gagging. For gagging.
Yes.
Now, and I would agree, like gagging's not necessarily a bad thing. So there, I'm going to agree with them. But to represent that somehow there's more gagging with the traditional method, I would disagree with that.
Yeah, I disagree with that too. And I think the book also minimizes how sometimes gagging can be concerning for parents when they're feeding their child.
Yeah.
So I do want to read a quote about how they see gagging.
Okay, yeah. Tell me.
So in this quote, they kind of describe another parent description of what feeding was like for them. And it's from Lucy describing her son, Isaac. To start with, when Isaac coughed when he was eating, we would jump up, get him out of the chair, and hit him on the back. But when we stopped and actually looked at what he was doing, we realized that if we just allowed him the time to cough something back up, it would always come out and he would just carry on eating quite happily. So in this quote, it kind of tends to minimize, what the experience a parent has when their child is gagging.
Yeah.
And for some parents, the gagging and the concern of choking is a very real concern for them.
Yeah.
And they're on alert and cautious about introducing solids because of that. So I feel like the book maybe tends to minimize that concern for parents. And in the office, I tend to be very attentive to that concern that parents have.
Oh, yeah, totally. What this makes me think of is that I do hear when people are speaking about baby-led weaning, sometimes I hear this push that you really, to truly baby-led wean, you should never be using a spoon to feed your child because that is no longer child-directed, that is parent-directed. And I think when you're at the season of life where you have a 6 to 12-month-old, I think you should accept all of the help that is offered to you. And plus, there are a lot of parents who are dependent on their daycare provider at that age. And I can confidently say as a mother, I would never want to put somebody in a position where they are feeding my child in a way that they don't feel comfortable with, whether because it's gagging or whether because I'm not sure they're fully educated on the right size pieces to give the baby at a certain age. So if I was in that position, for example, where I had a grandparent who was willing to help me by feeding my baby, and they only felt comfortable giving purees to my 6-month-old, then absolutely. Mm-hmm. I mean, I also want them to experience that joyful bonding of feeding the baby, as you talked about in a previous episode. If my daycare provider admitted to me that they had never done baby-led weaning, that they were hesitant about giving my child, a half of a soft pear to chew on, I would fully respect their opinions. I would not want to make them uncomfortable. I also would worry that maybe they felt like they couldn't be as attentive as they needed to be with as however many babies they have that they're caring for. I would absolutely send my baby with purees and feel much better about doing that. So I fall back on, I think baby-led weaning is a good tool to have in the toolbox. And for some infant parent combos will work great to fully follow it to a T. But I see absolutely no downside in combining methods or just doing traditional feeding. Mm-hmm. And I do think parental anxiety with regards to gagging absolutely should be factored in. I mean, the point of this podcast is that parents are reporting they're really under a lot of stress. So if we can lighten that by doing purees and stuff solids, sure, right. Easy.
Yeah. So I think we're clearly saying as pediatricians, if the parent feels uncomfortable with too much gagging, if other caregivers, babysitters, grandparents feel uncomfortable with too much gagging, the recommendation we would give is not push through, it's okay.
Yeah.
Our recommendation would be, let's go back to a more soft puree and until they're not gagging as much anymore.
Yeah.
Right?
Yeah. I
Yeah.
agree with that.
And the other point I want to make about gagging in this narrative is that, Isaac seemed fine with gagging and he continued to eat happily. I don't think that's the narrative for every child.
Oh, yes.
There are a subset of children that gagging becomes something that gives them a lot of discomfort and can actually lead to food and eating aversion.
Yeah.
When gagging happens too much.
Yes.
And if your child is not prone to being sensitive to gagging, sure, it's not a big deal like Isaac. But just for parents to be aware that sometimes gagging is a bigger deal for children, and parents should be aware if that is the case, then maybe stepping back to foods that cause less gagging might be beneficial.
Yeah. Okay, Sylvia, you have another one for me.
Sure. I think maybe as this baby-led weaning technique that was introduced, early 2010 to 2015 has evolved basically in the last 10 years, it has kind of changed and morphed, from what the book says to like all of the media that we consume about baby-led weaning today. So maybe in the second half, we can kind of talk about that transition and change of baby-led weaning and our thoughts of what baby-led weaning is thought of or assumed to be today.
Okay, that sounds good.
Vivian, I would like to hear your comments about what we've described about baby-led weaning and how it's described in the book to what your research has led to what baby-led weaning has become today.
Okay, yeah. So I do like using the book because I find with any of these, similar to gentle parenting, we really want to go to the source and hear what they have to say. And Gill Rapley is really credited with initiating this movement and naming this movement. Now, in the 10 years that have ensued since that book was published, there is so much information about baby-led weaning that I really feel this burden for parents of this idea of what could be information overload.
Yeah.
And I think about how baby-led weaning initially and still is billed as the easier way to feed your baby, because in theory, you're just feeding your baby what you're feeding your family. I'm not convinced that that's true.
Yeah.
And, I could go down this endless rabbit hole of podcasts wanting to understand baby-led weaning, of cookbooks that are out there now for baby-led weaning, of recipe plans for what food to start on what day, at progressing through the months for baby-led weaning. And then I suddenly find myself scratching my head and thinking, okay, is this easier?
Yeah.
And if it is easier, how did I all of a sudden come up with this infinite supply of resources, which if I am a very well-meaning, conscientious parent, I might feel compelled that I need to explore so that I know that I'm doing the best thing for my child. And suddenly I have a lot of time, if not money, invested in this thing that was supposed to make life easier for me. And I just am worried that it actually is not making things easier for all parents. For some, I'm sure, do it smoothly and easily and don't think twice about it. But there is just so much information on it. I worry that we've turned something that maybe started out with the idea of being simple into something that could be very, very complicated.
Yeah. And you mentioned this in our previous episode, introducing baby-led weaning, that the period of time where we go from introducing solids to the baby kind of eating
table food on their own,
is a mere 6 months.
Yeah.
And to go through so much cookbooks and time and listening to podcasts and recipes for that very short, finite period of time. If some people want to pursue that, great.
Yeah.
But I would hate to hold a standard to say that in order to be a good mom, you have to do it this way.
Yes,
right?
Yes, I totally agree. I think there's also a couple of assumptions that are made with it. And one of them is, I live in a place where we still have in our catchment area where there are food deserts, and the food desert's defined as an urban area where there's not easy access to fresh produce. And in that case, store-bought baby food may be the easiest option to get a good variety of produce to feed a baby.
Yeah.
And I would hate for a parent to feel like that's not a good option for some reasons. Yeah.
So it's very case by case, I think, based on what you've outlined.
I hope we've made it very clear. I am very supportive of baby-led weaning. I'm very intrigued by baby-led weaning. I can see how this early introduction of solids could be very fun. What I don't like is whenever baby-led weaning is painted in a light that it is somehow the better option, or the option for the more conscientious parent on what they're feeding their child and how they're feeding their child, or that it is somehow better overall for the child's development. I just don't think those things are true. I certainly wouldn't say that baby-led weaning is better in some way than a more traditional method. So I think parents should absolutely feel the freedom to do whichever method they feel comfortable with, or whatever level of combination they feel comfortable with.
Yes. And I agree with you. In the office, when asked, can we do baby-led weaning? I say, by all means, yes.
Yeah.
Like, let's give it a try. But I have seen particular babies, whether or not it's choking or gagging, or, they can't handle chunks yet, that baby-led weaning doesn't work for them. And then I tell them to go back to the traditional method. Right?
Yes. And I certainly see parents where there is an anxiety level concerning their baby's safety and health that are already expressing fear about watching their baby gag, where I remind them, just give purees.
Yes.
You don't need to do this. So I think an interesting discussion, Sylvia, would be, now that we feel pretty well versed in baby-led weaning, what would you do?
Yeah, I think that that's a tough one. I think that baby-led weaning, for me, I see it as the traditional way, and the way that I did feed my children, with the absence of the puree phase. I think that might have made my life easier, especially when you have more kids.
Yeah.
To put that puree phase on hold.
Yeah.
So I think it probably would have given me a little bit more freedom.
Yeah.
To skip the puree if I wanted to.
Yeah. Yeah.
And I think probably with a subset of my kids, it would have been successful.
Yeah. Yeah. Okay.
What about you?
Initially I would think about baby-led weaning and think oh yes, I would totally do that. But as I really sat on it and thought about it, I think the reality is that feeding my baby purees, and largely store-bought purees.
You didn't even make your puree yourself?
I know. It was just generally easier.
Yeah.
It was an easier choice for me, especially when I got to the point of having 6 and they were young, and I, was using older siblings to feed the baby. I mean, I think just being able to mindlessly know what the baby was going to eat without having to do any special preparation, I just think I would do it again.
Yeah.
Now, that being said, I do think I would have fun with occasionally throwing that that chicken bone to my baby and just seeing what they would do and video it and all of that. But I think that's where I would fall on it now.
Yeah. And I think for me, my caretakers, was my mother.
Yeah.
And she enjoyed the puree prep.
Oh,
right?
Yeah.
And then there were some ethnic foods with a rice congee that she would make.
Yeah.
With broth and specific vegetables that she would blend up and feed. This was her joy. And I don't think I would have taken that away from her.
Oh, no.
Yeah.
Yes, you wouldn't want to. Yeah. That's so special.
Right.
Yeah.
So I do want to end on, any type of feeding plan that gets parents excited about feeding a healthy, fresh fruit and vegetable, even steamed or softened forms of that to their baby. I am all for any parent that wants to get excited about a healthy meal plan that is in all intents and purposes safe. I am in full support of, right?
Oh, totally. More power to you. I've already admitted that I fell back and would still fall back on charred store-bought baby food. But you have my respect.
Exactly.
So there is a lot of fun in that, as long as it doesn't become, again, as there are so many things in parenting, this high standard that needs to be held to perfection that is somehow judged if you choose another option, because we are clearly saying, I fully disagree with the idea that one method is better than another.
Right. I think that is our take-home message for baby-led weaning.
Sounds good. This has been fun. Let's find some other controversial topics to discuss.
Great. This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.